Well, hello, everyone, and welcome again to the podcast. And I'm happy for you to get to know today Nicholas Samstag. Welcome, Nicholas. Glad you're here.
Thanks very much. Thanks for having me.
Yes, and Nicholas is in New York. And as we're recording this, we were just commiserating about the heat that we're all enduring this summer. But Nicholas, as I start with everyone, why don't you tell folks a little more about yourself and how you've landed where you've landed?
It's always a privilege to be able to tell my story, and I'm always a little surprised that it took me as long as it did to get here. Started off as a very young person being very interested in the theater, which I pursued in college. But when I was in college pursuing the theater, I read this wonderful Russian dramaturg named Stanislavski, who talked about Freud and how Freud informed him on how he might better help his actors by requiring that they develop a psychohistory from of their character. And I was very intrigued by that. And I started reading Freud, and I graduated college, and I thought, what I really want to do is study literature. So I went to Columbia and I studied Greek and Latin. I got a master's in Greek and Latin. It sounds so strange to say that now, but I'm glad I did it. And I wrote advertising for a while. I didn't really know what I wanted to do. I was all over the place. And I got into my own therapy. A girlfriend of mine at the time was in it, and she seemed to be really helped by it. And I thought, I need to do this. I was having trouble with authority figures. I was being promoted. I was sabotaging myself. And so I thought, okay, so I'll get into therapy. And then I did it for a while, and I thought, you know what? This is really cool. I could probably do this too. So I then went back and I got a PhD in clinical psychology, and I still wasn't satisfied. So I thought, you know what? These analysts seem like they're really smart, and they do really interesting things, and they get to read a lot of interesting stuff. So I went and I did that. And then that's what brought me here. So I've been in private practice for about 30 years and taught university for 20 some odd years. And I love what I do. I get to see a wide variety of people and help them in some very difficult and often profound human situations. So
Yeah, that's really interesting story. And I guess I'm curious is, at least in my training, I always think of psychoanalysis as being kind of the maybe the bedrock or the beginning of our professions as psychotherapists and that sort of thing. And then, yeah, and maybe this is incorrect, but also think of, oh, well, there are better methods than psychoanalysis and that sort of thing. But it's something that you have stuck with. And what was it that has drawn you to it and kept you with it?
yeah, I think when one talks about psychoanalysis, not unlike when one talks about Freud, one has to be clear about the time frame that one's really interested in. Whenever someone says Freud this, Freud that, my back goes up. It's very rare that people actually have read enough of him to know the arc of his intellectual journey. And to your question, if you ask 100 of my psychoanalytic colleagues what psychoanalysis is, you're going to get a lot of different responses.
Hmm.
And I think it's, we could say it's unfortunate, but it's also a testament to how I think diverse and rich psychoanalysis is and can be. So it can't reasonably be compared to other modes of treatment unless you're really defining your terms. The
Hmm.
I studied at the William Alanson White Institute, which is one of the big old ones, contemporary psychoanalysis. And contemporary psychoanalysis is not your grandmother's psychoanalysis. So these are, one reads contemporary authors, one reads queer theory, one reads all kinds of things that are very much about present day. And the techniques, the so-called techniques that one uses really differs from practitioner to practitioner. When people ask me what my version of psychoanalysis is, I say something like, okay, so I believe that human experience necessarily comes from two realms. It comes from the so-called real world. I say so-called because we don't often agree on what that means. And the other realm of experience is unconscious, which has been proven over and over again. Not the
Hmm.
unitary unconscious of Freud, but the variable unconscious processes that we all have. So when someone comes into psychoanalysis, I am interested in hearing about both of those realms of experience. I'm not disinterested in the here and now and the what's actually happening. But I'm primarily interested in the integration or conflation of unconscious and conscious realms of experience. And I'm very active. I ask a lot of questions. I'm very present. I don't give advice typically because I don't think it does anything to give advice. As an old professor of mine once said, you give anybody all the advice they want, they just won't. So anyway, so that, and then of course dreams, working with dreams and not working with dreams in a formulaic robotic way, but actually in a heuristic fashion where you're asking the patient and yourself to associate to the material in ways that hopefully resonate. So
Yeah.
that's, I think, what I
Yeah.
do.
Well, I think as I think about this, I think at least in my own practice, there are elements of psychoanalysis that we really all probably use. I mean, in particular, when people come in and start talking about maybe a dream that they had and really just kind of helping them kind of break down and make connections with things. Is there a particular kind of method or whatever you use when you're just thinking about dream work, for example?
Yes, absolutely. Great, wonderful question. And
Hmm.
it's something that I think about all the time. If Freud only gave us the notion of free association, we'd be forever in his debt. So the difference between an association and a thought is that a thought is deliberate. It's deliberate. I ask you to go think about urban planning and what you would do. All right. So you're going to go away and you're going to think about this and you're going to research it and it'll be deliberate and conscious and all of that. Free association is simply what comes to mind. Carl Jung was the first one to develop the free association test. You give people, these are wonderful tests, I think. You give people words, arbitrary words. If I say, if I give you the word duck and you say yellow, it's like, okay, that's not a thought, that's an association. If I say
Hmm.
duck and you give me an exegesis on the history of ducks, those are thoughts. And so in dream work, not unlike in other aspects of psychoanalysis, analysts are interested in the free associations of their parents. That's a good slip of their
Hmm.
patients. What are the associations? And the gold there is that we don't know what the meaning is until we associate.
Mm.
And
Yeah.
it's often the case, unfortunately, that clinicians tell the patient what the dreams mean, and they read these ridiculous dream books. If you dream that your teeth fall out, that means you think you're a baby or something. It's just ridiculous. Freud didn't talk
Hmm.
about that. There's no answer to the dream. There's no answer, but there is the capacity to expand your and the patient's awareness of what's going on.
Hmm.
So it's of extraordinary use and benefit if the two people involved can do it. I have some of my best moments in my work are just that. And I'm not the answer man. I don't tell them what I think it means. I simply associate with them. And if it doesn't resonate with them, it doesn't resonate. So
Hmm.
it's much more a heuristic. It's a heuristic approach. It's an approach that's interested in a continual expansion of associative material, not, this is the answer and this is what you're supposed to do now. And it's not for
Right.
everybody. Yeah.
Right. What do you think of the notion that when we have recurring dreams, in other words, dreams that are kind of the same kind of dream or theme or whatever, that being something that we're still trying to work through within ourselves?
Yeah.
Yeah.
I think that's absolutely true.
Hmm.
And and so elegant that the mind brain can do that. You know,
Right.
it's like you're right, that there's something in the material there that you on a certain level really want to get into and engage with and maybe solve. But there's
Hmm.
another part of you that doesn't want to be anywhere near it. So yeah,
Hmm.
those are great dreams. And that's, it's also important to note that, the more analytic, I suppose, one is in a way, the more one is looking for symbolic significance. It's
Hmm.
like, what does it mean? So if you have a dream about actual people in your life, that's a relevant that's relevant to inquire about. But it's also it's also interesting and fun, actually, to wonder what the symbolic value is of those people who appear. I mean,
Hmm.
yes, it was your mother and your father and your uncle. That's great, but what else can that represent? And that's an often very powerful journey for
Yeah.
both parties.
Yeah. Yeah. And so outside of dreams, when we, that's how I think about psychoanalysis, is that we help people make associations between maybe their behavior, how they do something, and then maybe, and you correct me if I'm wrong, of then once they're aware of those associations, then they can make a choice about how they want to proceed with things moving forward. Is that,
Right.
am I in the right ballpark there with that?
I think most contemporary psychoanalysts would agree that, our bias, I'm not going to speak for the field, my bias is is to help the patient make their own choices.
Hmm.
Ask me what I think, you know, I will usually tell them, but it's very much their show, not mine. I I think
Hmm.
I think I think I think most of us, and myself included, I think we talk too much. You know,
Yeah.
I think we talk too much and don't allow for silence, not silence, but silence. People they can actually do something other than recite things. Patients
Hmm.
come in. I had a supervisor 100 years ago who said patients come in to have their symptoms blessed, which I always loved. So I think psychoanalysis is unique in that it really doesn't have any dog in the race in terms of who you are or what you're going to be, as long as you're not hurting anybody. I don't
Hmm.
tell people how to think better or feel better. I don't believe in good feelings and bad feelings. I believe in, introducing them to themselves, really. That's my job.
Hmm. Yeah. Yeah. I like that. I like that. Yeah. So maybe take us through maybe a kind of a typical session. I know everybody's different, but when you when you think about starting with a new patient, what is it that you're focusing on or trying to get to with them? And I know a lot of it's going to depend on what their goals for therapy are, but yeah, can you kind of walk us through that?
Sure. I'm first session and every session after, I'm interested in what the person's experience is. So
Hmm.
I'll say something complicated like, how's it going?
Yeah. Yeah.
How's it going?
Uh-huh.
And and often patients want me to engage in their recitation of why they think they're here.
Mhm.
My job, my lover, my this, my that. And I'm interested in that, of course, but I'm much more interested in what their experience is. What's it like to be in here? What's happened current? Why did you call me when you did? I think that's
Mhm.
always a great question. Why are you
Mhm.
coming in?
Mhm.
And to be where the patient is, I always try to just be where they are and use what they're saying to me as a way into their difficulties. But I think I do my best work when I say the least.
Yeah. Yeah. Maybe is it a way of maybe saying or maybe teaching people how to kind of sit with the feelings and emotions that they're experiencing in that moment?
Yes, absolutely. That's
Yeah.
absolutely right. And I also think it's one of the things that I enjoy doing this. One of the things I enjoy about this work so much is that I don't have to abide by the sociocultural rules of discourse, right? I
Hmm.
don't have to I don't have to put it on. I don't have to do things like, so how are you? Right? I don't have to do
Hmm.
the baloney stuff that we
Hmm.
typically have to do out there. I don't have to answer questions. No, I can sit in silence, and I think that's it. I mean, that's the answer. You gave me the answer. That
Hmm.
I think people don't sit with their experience much, especially
Hmm.
today when we're
Hmm.
multitasking, all our gizmos are going off, and we're so externally engaged. And some patients, they can't do it, or they really resent doing it. It's like, I had a patient years ago who said to me, Dr. Samstag, at the rates you charge, you should be talking a lot.
Yeah. Yeah. That's
I
funny.
said, I
Yeah.
said, well, I said it's not the word count that counts here.
Yeah. 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 One question that I always tend to ask people early on, and when I do sessions with, start working with folks, is I ask them, I'll say something along these lines. Obviously, you've thought a lot about what's going on with yourself, and it's something that brought you here. So why do you think you are like you are? And so that they always get kind of a surprised look on their face. And
Hmm.
I think I don't know if that would be considered a psychoanalytic technique, but it does, I think, help them kind of get into what they're doing. I mean, get into
Yeah,
what they're experiencing in that moment.
I think that's a great question. I mean, I think, not this is a huge subject, of course, but the notion of technique is always a head scratcher, unless you're talking about, I think, manual driven therapy or behavior therapy or cognitive therapy, in which, people will tell you what to do. Technique and psychoanalysis, I don't know. I think we all have different ways of doing this, but anything that gets the patient curious about who they are, I mean, if you want to call that technique, I don't really see it as technique. Technique to me is applicable in engineering and medicine, and when you do, it's like this is how you take out the appendix. This is
Hmm.
the technique for building, mixing concrete. But I don't think there's a technique here, really. I think there's a sensibility that I think you have to cultivate where
Hmm.
you're not, how would I describe it? The analytic attitude over the years. I always loved that phrase, which
Hmm.
which often meant, don't respond and just sort of act like a jerk, really, frankly. But I
Hmm.
that there is an analytic attitude, and I think it has something to do with respecting the person,
Hmm.
so that you're not engaging as you would at a bar or a cocktail party. You're not trying to be nice.
Hmm.
You're especially not trying to evoke any given feeling. There is a kind of neutrality, I think. I don't believe that analytic neutrality exists, but I think it's a really good thing to think about.
Right.
Think there's anything, I don't think optimal clinical intervention exists, but I think it's a really good thing to think about.
Right.
But
Right.
why are you saying this then? And why, all of that. I think that keeps us honest.
Yeah. Yeah. If nothing else, it helps people learn to be curious about themselves and curious about their internal world.
Yeah. Yeah, and hopefully, and this is something that, certain people can do better than others. Hopefully being able to switch sets, being able to talk about the here and now with you, the clinician, talk about what's happening in their life, have an association to the past, have an association to their dream, not be on railroad tracks, and which is, I mean, most of this is no news to you. Most of human discourse is defensive.
Hmm.
It's defensive for a reason, right? You can't walk into a restaurant and just start free associating. They'll call the police. It's like you're
Right.
in a restaurant, you're supposed to act like you're in a restaurant. If you're in a church or down in the street, and you're supposed to, and that's all. I mean, I'm milking the word defensive, but it's defensive in the sense that you don't dare not do those things.
Hmm.
If you break those norms, people think you're a weirdo, and you would be, right?
Yeah.
Whereas in the consulting room, you don't have to do that. You can have people the freedom to say whatever they want to say. What the cardinal rule of psychoanalysis, say whatever comes into your mind. You don't have to make sense. Making sense is not what you're supposed to be doing. In a way, you're
Mhm.
supposed to be making nonsense, right?
Right. Yeah. Yeah. I love that. I love that. What one of the things maybe that I'm curious about, and maybe other people listening would be curious about, what do you find is the best way to help people kind of access the subconscious? In other words, I know it's a lot of it has to do with free association, but what, how do you get maybe people there, if that makes sense?
That's a great question. Yeah, again, I think that the way you get there is you say things like what comes to mind,
Mhm.
as
Yeah.
opposed to tell me a very, thoughtful, scripted something. You say what comes to mind.
Yeah. Yeah.
And I think the most direct way, and I do this all the time, pay attention to your language. Hear what you're saying and wonder why you're saying it the way you're saying it.
Hmm.
Language never lies. Language never lies. Language is necessary. These are not my ideas. Language is necessarily saturated with psychological meaning. And if you pay attention to your language and the tone of your voice, you will learn a lot,
Hmm.
right? Like, why did you say that as opposed to that? You know,
Hmm.
I have PhD candidates who say that their patients messed up. And I say, what does that mean?
Hmm.
What does messed up mean? Messed up means they were in the wrong relationship. They were in a difficult relationship. I said, who's not been in a difficult relationship? Why is that messing up? Is that messing
Hmm.
up? Is that
Hmm.
just so
Yeah.
I got a lot of mileage out of that. I drive some of my patients crazy that way, but you
Hmm.
know, it's Freudian slips are there for a reason. But even more subtly, how we speak is hugely significant. And
Hmm.
if the question is how do I get to my unconscious, that's one of the answers, I think. Pay attention. Pay attention to how people are talking and what they're saying and why they're saying what they're saying when they're saying it.
Yeah. 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 I think that's, I totally agree. I know that words and the way we frame things is very powerful in just, and just understanding what's underneath with people and what are their internal motivations for things, which has always been fascinating. One little quick story I'll share with you, going back to the dream work things. I remember several years ago when I was in a different career, I had a friend of mine uh, she was trained in psychoanalysis. Her name was Anne, and I was just having a conversation with Anne at church, and we were just talking about dreams and just how fascinating they are. And I shared with her, I keep having this same dream of being on a train and just going down the track on a train. A lot of times it's like an old locomotive or old rickety track, all of that sort of thing. And she began say, well, what is it that's characteristic about being on a train? And I said, well, you just have to go where the track takes you. You can't steer it in any way, which is how I was thinking at the time. And then it dawned on me at the time that I felt stuck in my career
Yeah,
and I really needed to get on a different track. And so, yeah. So I don't
that's
know if that's a good example of how all this works.
That's a lovely example. I love that example. And you're in famous company. I mean, Freud, when people asked him about dream analysis, he said, picture yourself on a train.
Uh-huh.
Picture yourself on a train looking out the window and just tell me what you see. Now,
Hmm.
my I think that's lovely. My only quibble with that is that it's linear.
Mm.
And I think what we want to do with our patients is introduce them to non-linearity. It's
Hmm.
it's not about being on a track. Free association anyway. It's about letting whatever comes into your mind come in. So it can
Hmm.
come from the top or the bottom, or the metaphor of linearity doesn't really work there. But
Yeah.
I think for your dream, yeah, absolutely. That's great. I've had similar dreams about, not finding the right exit, driving and not
Uh-huh.
finding the looking for a way to get off the road, but not finding it. I mean, all that stuff. Right? But
Yeah.
then, I mean, that's great and profound. And if one had time, one could probably spend a year on this dream, right? And come up with all kinds of other things that would not be arbitrary, but would be, again, based on associational connectedness. This thing leads to that thing leads to that thing. Before you know it, you're talking about everything under the sun.
Right. Right. Yeah. It's funny how thoughts work that way, and that you can, I'm always reminded of that children's book, If You Give a Mouse a Cookie, and it goes, just on this big long tale about, well, if you do this, then this will happen and this and that will happen. And so, yeah, that's how I think about it in a way.
That's great. Yeah.
Yeah. Yeah, that's great. Well, Nicholas, I have to be respectful of your time, and this has been a great conversation. Tell folks how they can get in touch with you if they would like to connect and talk with you.
Sure.
Hmm.
Sure. So you can find me at Nicholas at psychoanalysis.com. And that's my website. And on my website's, a bunch of stuff that I've written and videos that I've made and all that. So I'd be happy to hear from anybody.
Awesome. So, well, Nicholas, it's been a pleasure to get to know you, and hopefully we'll be able to chat again sometime soon.